Inflammatory bowel disease (IBD) is a term used to describe a group of chronic conditions that involve inflammation of the digestive tract. The two main types of IBD are Crohn's disease and ulcerative colitis. Here's an overview of IBD, including its types, symptoms, causes, diagnosis, and treatment. Types of IBD. Crohn's disease. Location: can affect any part of the gastrointestinal tract, from the mouth to the anus. It often affects the end of the small intestine ileum and the beginning of the large intestine colon. Characteristics: inflammation can occur in patches, with sections of healthy tissue between inflamed areas. It can involve all layers of the bowel wall. Ulcerative colitis. Location: primarily affects the colon, large intestine, and rectum. Characteristics: inflammation and ulcers are continuous, starting from the rectum and extending proximally in the colon. It typically affects the innermost lining of the colon. Symptoms can vary depending on the type and severity of IBD, but commonly include abdominal pain and cramping. Pain is often in the lower abdomen and can be severe. Diarrhea, frequent, watery stools, which may contain blood or mucus. Weight loss, unintentional weight loss due to decreased appetite or malabsorption. Fatigue, persistent tiredness and low energy levels. Rectal bleeding, blood in the stool or on toilet paper. Urgency to defecate, an urgent need to have bowel movements. Fever, low-grade fever may occur during flared UPS. Nausea and vomiting, especially with Crohn's disease affecting the stomach or small intestine. Causes: the exact cause of IBD is unknown, but several factors are thought to contribute. Genetics: the family history of IBD can increase the risk. Certain genetic mutations may predispose individuals. Immune system: IBD is believed to be an autoimmune condition where the immune system mistakenly attacks the gastrointestinal tract. Environmental factors: factors such as diet, smoking, stress, and exposure to certain bacteria or viruses may play a role. Diagnosis: diagnosing IBD involves several steps. Medical history and physical examination. Discussion of symptoms, medical history, and a physical exam to assess general health. Laboratory tests. Blood tests, to check for anemia, inflammation markers e.g., C-reactive protein and other abnormalities. Stool tests, to rule out infections and detect inflammation. Imaging studies. Colonoscopy, a procedure using a flexible tube with a camera to view the inside of the colon and rectum. Biopsies can be taken for further analysis. Endoscopy, to examine the upper gastrointestinal tract if Crohn's disease is suspected. CT scan or MRI, to visualize the extent of inflammation and complications in the intestines. Biopsy, tissue samples taken during endoscopy or colonoscopy to confirm diagnosis and differentiate IBD from other conditions. Treatment for IBD aims to reduce inflammation, manage symptoms, and achieve remission. Medications: anti-inflammatory drugs, such as mesalamine for mild to moderate symptoms. Corticosteroids, to reduce inflammation and manage flared UPS e.g., prednisone. Immunosuppressants, drugs like azathioprine or methotrexate to suppress the immune response used for more severe cases. Biologics, targeted therapies like infliximab or adalimumab for moderate to severe IBD, often used when other treatments are ineffective. Antibiotics, to treat or prevent infections, especially in Crohn's disease. Diet and nutrition. Special diets, identifying and avoiding trigger foods. In some cases, a special diet or nutritional supplements may be recommended. Hydration, maintaining adequate fluid intake to prevent dehydration, especially with frequent diarrhea. Surgery. Crohn's disease, surgery may be needed to remove damaged sections of the intestines or address complications. It does not cure the disease but can relieve symptoms. Ulcerative colitis. In severe cases, surgical removal of the colon and rectum colectomy may be necessary, often resulting in the creation of a new way for waste to leave the body, ileostomy or J-pouch. Lifestyle modifications. Stress management. Techniques such as relaxation exercises, therapies, and mindfulness can help manage stress, which may exacerbate symptoms. Regular exercise. Engaging in regular physical activity to improve overall health and well-being. Complications of IBD can include intestinal obstruction, blockage of the intestines, fistulas, abnormal connections between the intestines and other organs or skin, colon cancer, increased risk with long-term ulcerative colitis, nutritional deficiencies, due to malabsorption or dietary restrictions, anemia, resulting from chronic blood loss or inflammation. Prognosis. IBD is a chronic condition with periods of flare UPS and remission. With appropriate treatment and management, many individuals can lead active and fulfilling lives. Regular follow-up with a healthcare provider is essential to monitor disease progression, adjust treatment, and address any complications. Conclusion. Inflammatory bowel disease requires ongoing management to control symptoms and maintain quality of life. If you experience symptoms of IBD or have concerns about digestive health, consulting with a healthcare provider for evaluation and tailored treatment is essential.